All right, today we're going to talk about a few of the congenital heart defects that you could find in the NCLEX. All right, first up is an atrial septal defect, commonly abbreviated as an ASD. This is a common heart defect and one of the most straightforward, so you're likely to see it on the NCLEX. It's quite simple. There is a hole between the two atrium in the heart. The septum that should separate the right atrium from the left atrium didn't fuse properly, so there is blood flow across the atrium. This leads to what we call left to right shunting. There's higher pressures in the left atrium, and so those high pressures push blood to the area of low pressure in the right atrium across that septum. This leads to a mixing of blood. So the baby will be deoxygenated. They'll likely have oxygen saturations between 75 and 85% due to the mixing of their blood. This also leads to higher pulmonary blood flow because of that high pressure in the left atrium, shunting blood across the atrial septum into the right atrium, where we pass more blood to the right ventricle and out into the lungs than we do in the body. Atrial septal defects are common in Down syndrome and with other heart defects as well. The next heart defect is called an AV canal. In our last one, we talked about a hole between the two atria. In an AV canal, we have incorrect development where the valves between the atria and the ventricles do not form properly. So we have essentially holes between the atria and the ventricle on both the right and the left side. This creates a canal, so that's why we call it AV canal, atrioventricular canal, between the upper chambers of the heart and the lower chambers of the heart. They should be separated, but instead we're essentially dealing with two chambers here, just the right and the left, and they're not properly separated. This leads to a lot of regurgitation, backward blood flow. Again, these children are going to have mixed blood where in their case, they're going to have mixing of blood across a patent ductus arteriosus or a PDA. So these children will also have lower oxygen saturations and need very significant cardiac repairs. This cardiac defect also leads to increased pulmonary blood flow. Next up, we have a VSD. This is going to be similar to the first defect we discussed, but in the ventricles instead of the atria. The septum between the right and left ventricle has a hole in it, a ventricular septal defect. Again, blood in the higher pressure left ventricle will shunt across the septum into the right ventricle. This is going to lead to increased blood flow to the lungs, and again, mixing of oxygenated and deoxygenated blood so that the child will have lower oxygen saturations. These are usually repaired with a patch and have a good prognosis. Okay, last but not least, we have aortic stenosis. This is a very common defect and often found in conjunction with other congenital heart defects. Very simply, the aortic valve, where blood is supposed to be pumped out from the left ventricle to the body, is stenosed or narrowed and hardened. This makes it really hard for the left ventricle to pump blood out to the body, leading to left ventricular hypertrophy, increased pulmonary vascular resistance, and decreased cardiac output. Aortic stenosis can often be fixed with a valve replacement or a ballooning of the aorta, but it's commonly seen, as I mentioned, with other things. This can lead to long-term problems, decreased oxygen saturations, but it does not lead to increased pulmonary blood flow. Why? Because the problem is solely confined within the left ventricle. The aortic valve is stenosed. It's difficult for the left ventricle to pump blood out to the body, but the pathway of blood through the heart is correct. There's no mixing of blood. There's no shunting from right to left or left to right. There's no increased blood flow to the lungs. It's simply a narrowing of the aortic valve, which makes it difficult for the left ventricle to pump sufficient blood to the body. And again, this is usually repaired with a valve replacement. All right, that's all we're going to go over about cardiac defects today. There are lots and lots of cardiac defects, but not all of them are covered on the NCLEX.